I'm going to give myself an example, and I talk about this in my book, that I never struggled with weight. I used to lift weights all the time since I'm 20. I love it. But then in pregnancy, it was like a switch went off, and I said, oh, if it's not now, when? And I gained 70 pounds. And then in my second pregnancy, 5 months later, after my first delivery, I got pregnant again. So then I was, and then when I finished giving birth, I was in perimenopause. So it was like everything. So I used the GLP-1 for 6 months, got to my weight, and I haven't had to use it again, right? But in my family, I don't have family history of obesity, and I didn't struggle with obesity or weight gain in childhood or teenage years. That's why. But maybe the same person exercised and gets pregnant later in life, perimenopause, but they have a strong family history of obesity, or in their childhood, teenage years, they did struggle with weight, then most likely at that time, they may need it long term. The response is going to be very individual to the patient reason to need the medication to begin with.